right. Okay, here's urinary system part 2. Okay? This is like P section part 2. Okay? Kidney disease. Are you ready to hear about kidney disease? Yeah? All right. It's frozen? Really? Oh, shoot. Okay, frozen. Okay, chronic. Okay, chronic kidney disease. This is typically caused by high blood pressure. High blood pressure. The pressure damages the vessels. Did we do this one already?
We're all the way down to the last one on.
Oh, we did this one already? Okay, well then we go. That's a review. We did this one too. Yeah, you're right. Okay. The last point, which is. Yeah. We got to go up here. No. Here we go. This part right. Oops. I thought we were on a new section, but maybe not. So this is the one here?
Yeah.
That's where we left off? Beauty. Okay. Urinary tract infections. UTIs. UTIs, I think they're called. This is when the urethra or the bladder becomes infected with bacteria. This is typically treated with antibiotics. So if you have a urinary tract infection, sometimes it's your bladder, a lot of times it's the small tube between the bladder and exit door there. Okay? So UTI, urinary tract infection. And yeah, like drinking, I don't know, fruit juices. I don't know, cranberry juice, I heard that helps. There's also like medications. And just drinking enough water to make sure everything gets flushed out so your body can naturally flush out infection stuff. So good to do that. All right, kidney stones typically are left to pass on their own, but if treatment is needed, there are some options, like drinking lots of water helps to dilute them and prevent them from forming. I think what?
There's a slide missing.
Oh, you think there's a slide missing?
Yeah.
Really? No. Okay. What's the what do the notes look like?
The main treatment.
Main treatment for.
Oh, here we go. This is the one. This is the one. Okay, so urinary system treatments. All right, sorry, it was on the bottom of this page. The main treatment for chronic kidney disease is dialysis. We talked a little bit about that yesterday. Dialysis is when you hook up a machine that pumps your blood out through another machine that mimics the kidneys and cleans the blood. So it pumps your blood out and cleans it and then returns it back to you. This treats the symptoms and keeps the patient alive but doesn't cure the disease. So if kidney transplant, I guess you can get kidney transplants if you got serious chronic disease, but that's hard to get. You got to find another person that is a match, and the situation has to, like any transplant, right? The situation has to be just right, that you can actually get a transplant from somebody else that's living or has passed away, unfortunately. So some patients need to do dialysis multiple times a week, others even daily, as we talked about yesterday. Any questions? We good? All right, let's get to this one now. Kidney stones. Now we're at kidney stones. Typically have to pass on their own. Drinking lots of water helps dilute them and prevent them from forming. An ultrasound can break up kidney stones into smaller pieces. In extreme cases, surgery can remove them. So you zap them with literally high frequency sound waves. It can actually like bust them up and easier for them to pass. But that's, yeah. Usually they just kind of pass on their own. But it's a very painful process, as you can imagine. They're quite jagged and sharp, these little stones. I actually knew an old man that passed a kidney stone. He kept it. Like he passed it and he like kept it in a jar and he showed me. I'm like, oh, okay. All right. It was like this little, like a little tiny little pebble, like bigger than a grain of sand, but it's like this tiny little rock that might get stuck in the tread of your shoe, like that size, you know? But it was like all like jagged. It was like sharp everywhere. I was like, I can't imagine. You have to pee that thing out. Like that's what it has to come out there. So like trying to get that to come out. And getting it stuck and everything, like, can you imagine? Yeah, pain. Anyways, yeah, he showed me there. Look at this. Look at that. Okay. All right. Urinary system diagnostics. The most common way to diagnose urinary disease is by urine analysis. This is when the urine itself is analyzed to see what it contains. This provides clue as to the health of the patient.
Is
Somebody say-
anyone else missing that blood? Oh, okay.
What are you missing now?
I don't know. There's like this one line here. It's like something are treated with something.
Blank are treated with blank.
I got these separated too much, I guess. I missed them. Infections are treated with antibiotics. Bad, my bad. Yeah, I did this. I kind of separated them a little bit so that they wouldn't be on the same screen so I could talk about one section at a time, but now I'm missing them. All right. So sugars could mean that the patient is diabetic as the sugars are not being reabsorbed. Okay, so yeah. So sugars. So to diagnose urinary disease, urine analysis, sugars, the patient may be diabetic since sugars are not being reabsorbed. Ketones, if there's ketones in the urine, this could mean the patient is starving and breaking down extra fats into sugars, though it could also be the result of strenuous exercise. So if you take chemistry 30 or advanced placement chemistry, ketones is an organic functional group, and it's a category of organic compounds. So ketones, you'll maybe learn a little bit about those. Yeah, strenuous exercise, yes. If the person is not doing strenuous exercise, then it's a sign that the body is sort of like eating itself, eating up all the storage fat anyways. Calcium, okay, higher calcium levels may be due to dehydration or bone or kidney disorder. Bone or kidney disorder. So, yeah, calcium would generally be dissolved and peed out. If there's, well, I should say that if the urine has high calcium, then there's not enough water to dissolve it and help it to go where it's supposed to. Yeah. Okay, so high levels of sugars or ketones or calcium can tell us something about the patient. If there is blood or hemoglobin in the urine, this could be the result of liver or kidney damage, infection, or kidney stones. So you can imagine if you have kidney stones and little jagged kidney stones causing havoc in the system there, it could be actually causing your blood vessels to break and bleed, and it could be the result of that. And protein. So if there's high levels of protein in your urine, this could be the result of high blood pressure, diabetes, autoimmune disease, or infection. So if there's protein in your urine, it could be a result of high blood pressure, diabetes, autoimmune disease, or infection. pH, okay, so the pH level of your urine, if that is consistently lower than 4.5, that's really acidic, and it may be a sign of diabetes. I think generally your urine is a little acidic as it is, but remember 7 is neutral, so anything below 7 is acidic, and really acidic is a bad thing. Okay, looks like this is the last page. All right. Bilirubin. So if there is any bilirubin in the urine, it may be a signal liver damage. So bilirubin. Is that bilirubin? I think is the bilirubin that causes jaundice. I think.
Yeah.
So it'd be what causes the yellowish. Yeah, excess bilirubin is jaundice. Yeah. So we learned a little bit about that. You guys read about that? I always found that was a funny word, bilirubin. Yeah. I think I mentioned one of my kids had a little bit of jaundice. So they put her under the light.
I had jaundice as a baby.
Yeah, did you? Yeah. So they literally put the babies, like put a mask on them and then put them under this big bright light, and that seems to help.
Yeah, but I hated it, so I would always crawl out from under the light.
Oh. Okay. No, I don't like the light.
And we were like bile, so that's how I remember.
Oh yeah. The prefix there, bile, kind of a bile root. Yep. Yeah. Okay, nitrates. These indicate infection. Nitrates indicate infection. So obviously we aren't going into too much detail on these systems, just a lot of overlap to infection, disease, you know, that kind of things. Okay, is this the last bit of notes here in your page? So the other diagnostics can be done that would be ultrasound, X-ray, CT scan, or MRI. So ultrasound, X-ray, CT scan, or MRI. Okay. Yes.
What's a CT scan?
So I was thinking of ECG with the heartbeats and all with all the nodes. That's an ECG. The CAT scan and the CT scan are the same thing. Yeah, a CT scan will show. It's a computer-enhanced X-ray. It's most often used to evaluate complex parts of the body, head, chest, some joints, and various internal organs. It's similar in, I guess, idea to an MRI, I guess, but it's not the same. Yeah, complex body system. So it's like a boosted up X-ray. Yep.
For like, if someone who, let's say, has a small bladder, is that genuine, like they have a smaller bladder than